I hadn't planned on staying late that Tuesday, but the third-floor elevator had other ideas, so I took the stairwell down instead. The one that runs past neurology? The department nobody visits after dark because the fluorescent tubes hum louder than the monitors do. That's where I found him, again, like he'd been dropped there on purpose. Dr. Elias Vann, sleeves rolled, standing outside my patient's room a full 4 minutes before I called a rapid response that saved a man's life. My name is Priya. I was a clinical pharmacist at Ridgeline Community, 3rd year on the job, and I want to tell you about the man who kept showing up exactly when I needed someone to. The first time was in October. I'd caught a dosing conflict on a 91-year-old with a pacemaker, the kind of error that slides through when a covering physician is juggling 4 units at once. I paged the attending, got no answer, and was standing at the nurse's station chewing the inside of my cheek when Elias appeared, unhurried, like he'd been walking that hallway anyway. He read the chart over my shoulder without asking, said, "You're right, hold that dose," and then he was gone before I could even say thank you properly. Neurology had no business signing off on a cardiology order. I didn't ask why he did it. I was too relieved. It kept happening. Not every week, not even every month, but often enough that I started noticing the pattern before I let myself admit I was noticing him. A code on the medical floor, and there he'd be, 2 steps ahead of the crash cart. A shouting match with a family member in the hallway that I couldn't de-escalate alone, and somehow he'd round the corner at that exact moment. Calm voice, steady hands, the room settling because he was in it. My friend Denise, who ran days on the surgical unit, used to tease me about it in the cafeteria line. "Your ghost's here again," she'd say, nodding toward wherever he'd just vanished from. I told her he wasn't my anything. I mostly believed it. He didn't talk much. That was the truth everyone told you about him before you'd even met him. Brilliant, quiet, kept to himself, ate lunch alone with a paperback wedged against his tray. So when he started leaving black coffee on the pharmacy counter on nights, I'd pulled a double. No note, no explanation. I didn't know what to do with it except drink it and wonder. I told myself it meant nothing. I told myself a lot of things that winter that turned out not to be true. There was one night in January I still think about more than I probably should. A patient of mine, a woman named Corrine, who I'd gotten close to over 3 admissions, started crashing fast, and the on-call resident was slow getting there, and I was alone in that room doing everything I'd been trained to do, and none of it felt like enough. Elias walked in without being paged. I found out later, much later, that no one had called him. He just came. He worked beside me for 11 minutes that felt like an hour, and when it was over and Corrine was stable and wheeled up to the ICU, he looked at me, really looked, the way he never let himself do in front of other people, and said, "You didn't do anything wrong." Then he left before I could ask how he knew I needed to hear that. I started keeping a small, stupid list in my head. Every time he showed up. Every time it mattered. I told myself I was documenting a coincidence. Some part of me, the part that lay awake replaying his voice saying my name, that part knew it wasn't a coincidence at all, and that scared me more than any of the codes did. Here's the part I have to be honest about, because a story like this doesn't mean anything if you sand off the ugly edges. In March, I made a mistake. A real one, not a near miss. A verification I should have double-checked and didn't on a night I was too tired to trust my own hands. Nobody was harmed, thank God. The error was caught downstream, but the review board doesn't grade on, thank God. I sat through the hearing alone. Elias wasn't in that room. He couldn't have been. It wasn't his department, wasn't his business, and I remember being angry at him for it, which wasn't fair, and knowing it wasn't fair, and being angry anyway. Maybe you've had that feeling too, wanting someone to show up for the one thing they have no right to show up for. I handed in my resignation 2 weeks later. Not because they made me. They didn't. But because I couldn't trust my own hands anymore, and a pharmacist who doesn't trust her hands has no business standing at that counter. My last shift was a Friday. Quiet, ordinary, nobody crying, nobody thanking me, just boxes taped shut and my badge clicking onto the manager's desk like it weighed nothing at all. Elias wasn't there. I told myself that was fine. I told myself a lot of things. It was Denise who finally told me the truth, 3 weeks after I'd left, over coffee that wasn't nearly as good as the coffee he used to leave on my counter. She'd heard it from someone in HR who'd heard it from someone in his department. Elias Vann had a younger sister, nurse, pharmacy tech for a stretch before that, dead 6 years now. An overdose that started as a medication error nobody caught in time, at a hospital 2 states away, on a night shift that looked exactly like mine. He'd transferred to Ridgeline the year after it happened. He'd made a private, silent habit, nobody's assignment, nobody's business, of watching over anyone on nights who reminded him of her. Tired eyes, too many patients, not enough hands. He watched. He showed up. He never told a single one of us why. Because how do you say that out loud without it sounding like a diagnosis you're pinning on someone who never asked for it? I sat with that for a long time. I still do. Was it care, real and whole, meant for me? Or was I a stand-in for a grief he never let himself finish? Maybe it was both, and maybe both can be true without canceling each other out. I've turned it over so many nights since, and I still don't have a clean answer. Only the coffee and the 11 minutes in Kareen's room and the 4 minutes he stood outside a door before anyone called him. I called him, eventually. One conversation, awkward and careful, neither of us sure what to do with all that unspoken history sitting on the table between us. He didn't apologize for the silence. He said, "I didn't know how to tell you without it becoming about her. I understood that better than I wanted to." We talk sometimes now. Not the way I used to imagine. Back when I was 26 and half in love with a man who left coffee and no notes. But honestly, not less than that either. Just different, quieter, truer. I think about bay after bay of hallways he walked that weren't his to walk, all those years, for a sister he couldn't save and a string of tired women he could. I don't know if that makes him the most generous man I ever worked beside, or the loneliest. I've stopped needing to pick just one.